And Dr. Bhatia and Dr. Young, in your experience, not other cancers, there are screening tests out there. There are tests that are given for screening of cancers. Is there any test for the screening of skin cancer?
It's the dermatologist's eyes.
Interestingly, there have been some new apps, for the Android and iPhones that are looking at detecting melanoma early. And there was just an article, I believe, in the JAMA Journal of American Medical Association suggesting how inconsistent these apps are and how often they're just incorrect. There's also digital imaging, confocal microscopy, digital, photography. People have tried to see if they can get programs to detect melanoma early. And the reality is all of those in comparison to just an experienced dermatologist fail.
Question. We know that breast cancer can be hereditary, ovarian cancer can be hereditary. Is melanoma or another form of skin cancer, is it at all hereditary as well?
Not all, but there's a significant genetic predisposition. Definitely the demography or skin complexion makes a huge difference, but there's definitely genetic disorders which are associated with a higher incidence of melanoma. Clearly, if somebody has a family history of melanoma, they should consider earlier screening.
Dr. Bhatia, to kind of go on to that, what are some of the treatment options for melanoma?
When you look at patients who have stage 3 melanoma, unfortunately in 2013, the only reasonable standard of care is a drug called interferon. And it has been approved by the FDA for almost 13 years. Mm-hmm. At this time, there is a clinical trial in which a drug called ipilimumab is being compared to interferon with the hope that it may improve on the results that we get with interferon. In patients who have stage 4 melanoma, we have been very fortunate that in the last 24 months, 2 new drugs have been approved. The traditional treatment was interleukin-2, or a pill called Temodar. This is really an exciting time for metastatic melanoma. Specifically, we know that 40 to 50% patients who have melanoma have a specific molecular abnormality in the tumor. This is not a gene abnormality in the person. It's an abnormality in the tumor, and it is called BRAF. And there is a pill called vemurafenib, which specifically targets it and can produce dramatic results. It does not cure the disease, but can produce amazing responses in which the tumor can just shrink away. Another treatment is ipilimumab or Zervoy, and it works by stimulating your own immune system and helps to destroy the tumor cells. There are also new genetic mutations in the tumor which have been identified, called the c-MET mutation, and there are drugs which are being designed towards that. In our collaboration with MD Anderson, we've been able to offer patients access to those clinical trials and to those novel agents which are not available and are not FDA approved. That is really something exciting that we're able to get our patients to in a disease which is otherwise very difficult to treat.